Gateway 180. Thank you all for coming today. My name is Kathleen Beach, and I'm the Executive Director for Gateway 180. We are so honored to be hosting you today in our humble emergency shelter. This building has been serving families in the community since 1904 and has always been some form of community center. Gateway 180 is fortunate to be able to shelter adult women, families, single fathers, and we help them with both shelter and then moving them into housing. Our agency's mission is simple. We empower families to become independent and permanently housed. But we can't do this without the help of every Continuum of Care member in the city of St. Louis, as well as the assistance from the Department of Human Services. And most importantly, we wouldn't be able to do this work without the support of Mayor Slay. Like Mayor Slay, Gateway 180 has a vision to end homelessness in St. Louis. At this time, I would like to introduce Mayor Francis Slay, a friend to all people experiencing homelessness. It's a pleasure to have Mayor Slay today at our emergency shelter.
Kathleen, thank you so much, and thank you to everyone in this room and all who work with some of our most vulnerable citizens here at Gateway 180 day in and day out. We appreciate all the work that you do. And thank you all, too, for your efforts to help with what we're about to announce here today. Today, we take another step forward to providing even more and better services to people who need it the most in our community. In February, I told you that it's time to change emergency shelter for people who are homeless in the city of St. Louis. It's simply not good enough to warehouse people for a night in substandard conditions and then give them a meal and then send them on their way to fend for themselves until darkness comes again. Today, I'm proud to stand here with representatives of some of the most accomplished homeless service providers to tell you the city will begin providing nightly emergency shelter for people in need beginning this Sunday night. This would not be possible without the incredible support of a whole lot of people and organizations. The organizations represented are Gateway 180, which is where we are today, Salvation Army, St. Patrick's Center, Windsor Transitional Housing, Peter and Paul Communities, Doorways, The Bridge, and Catholic Charities Housing Resource Center. Thank all of you for all the things you do day in and day out and for your help here today. So beginning Sunday evening, April 12th, Gateway 180 will open its doors to this facility and provide emergency shelter for 50 single women and women with children. These children and women will have a place to stay not just overnight, but in the daytime as well, and will be connected to services designed to move them to permanent supportive housing as quickly as possible. Also beginning Sunday evening, April 12th, we will begin operations of a new shelter for 125 single men to be operated by the Salvation Army and Windsor Transitional Housing. These are all organizations that have a lot of experience in serving the homeless. The Salvation Army has been helping vulnerable St. Louisans for more than 130 years. Windsor has been operating the city's emergency cold weather overflow shelter for the past 3 winters. Salvation Army will bring to bear its network of case management and other services to move these men to a stable life. St. Patrick's Center will also be expanding its night program for women from 15 beds to 20 beds. This program provides not just overnight shelter, but services and a place to stay in the daytime for women with mental illness. And pending HUD approval, Doorways will add an extra shelter bed to its permanent supporting housing facility in the Central West End, a place where people with AIDS or HIV can be brought off the street while Doorways investigates ways to connect them with services. Over the long term, we are pursuing an additional 50-bed facility to ensure we have the capacity to meet all of our needs. These shelters, all of them, will be carefully managed in ways that ensure they are good neighbors. These shelters will meet any problem with a prompt and effective response. We have 36 facilities in the city of St. Louis, spread all over the city, that serve people who are homeless. Almost all of them are good neighbors. These facilities will be good neighbors as well. These agencies will treat emergency shelter the way it should be treated, as an emergency. These shelters will become places for new beginnings, not places of last resort. These shelters will be places where multiple agencies work together to move guests out of shelter as quickly as possible and toward permanent housing and independent living. I am grateful for the support of Alderwoman Tamika Hubbard, who's with us here today, and I know Jack Coder, the newly elected alderman of the 7th Ward, is supporting this as well, and for the hospitality of the neighborhoods that you all represent. I wish to thank the St. Louis Office of the United States Department of Housing and Urban Development for its thoughtful guidance and assistance in making this happen, and of course for their financial support. Above all, I want to thank the agencies represented here and the fantastic coalition of caring, accomplished service providers in St. Louis, the Continuum of Care for Homelessness. They will make this work, and I know we will help a lot of people. I want to now turn this over to Eddie Roth, my Director of Human Services, who has worked tirelessly with his staff and others in this room to fulfill our goal of getting these shelters up and running as soon as possible. Eddie?
Thank you, Mayor. Thank you, Mayor Slay, and good afternoon, ladies and gentlemen. My name is Eddie Roth. I'm the Director of Human Services for the City of St. Louis. I was appointed on December 15th, and the mayor made plain to me and to our staff and to his entire senior staff that we were going to have a new era of professionally operated, publicly accountable emergency shelter that's connected to services, shelter that moves people ahead. And he set as his goal that we should have this up and running by the middle of April. Today is, I think, April 9th, and so we are on track. And I'm just thrilled with the support that the mayor's team has provided me. There's no way that a new director could have made the headway that we've made without the cooperation from all divisions of city government, and as the mayor said, above all, the caring community itself. We start with public accountability by introducing to you, for just some brief introductions and statements about the programs, the people who will be serving the homeless in these facilities. But before I do that, I want to invite Alderwoman Hubbard up to say a few words, and we're just thrilled with her support. This facility is in her ward. She's been a wonderful supporter for vulnerable people throughout the city and this facility. Alderwoman?
Thank you so much. I would just like to say that I'm honored to be here today. The last time that I was here, we were here for the opening of Mac's Backyard, which is located in the back. And it's important because one of the children that were here said that their most challenging part about being homeless was missing their backyard. And so that's something that the city and other corporate leaders partnered together to do. And it's just important that we have facilities such as this at Gateway 180. Our mayor spoke to a key component when he spoke of we want to do more than simply warehouse people, and that's something that I definitely advocate hard for, and I would like to continue to serve Gateway 180 and the entire 5th Ward, and to just keep us moving forward and to take care of some of our most vulnerable citizens so that they can come back into society and be productive members. And once again, I'd just like to thank you, and I've always lended my support to Gateway 180. I've lived in this community all of my life, and I've seen the strides that you all have made, and I thank you.
All right, so we're just going to go down the list and ask representatives from the agencies to introduce themselves and tell a little bit about how they're going to be serving men and women and children who are homeless in their facility. And we'll start with our host facility and ask Kathleen Hines-Beach to come back up and just say a few words about the program and what will occur right in this facility.
Thank you, Eddie. Gateway 180's full name is Gateway 180 Homelessness Reversed. This name explains our agency's commitment to not just providing emergency shelter, but providing housing placement services for every family we serve. Our goal is not to recycle people from the streets to shelter and back to the streets, but to find permanent housing solutions. We do this through strong case management, partnering with other COC and community organizations, and by focusing on client accountability. Nobody changes because they want to. They change because everything else has failed. Change is instrumental in getting families housed and keeping them housed. Today, Gateway 180 runs our family emergency shelter, projected to serve more than 1,700 people this year. We also case manage clients in rapid rehousing apartments throughout the city. And additionally, we have permanent supportive housing in Soulard for our families. Thank you to everybody coming to today's event.
Thank you, Kathleen. We're going to turn now to the men's shelter, and the Salvation Army needs no introduction. It has been a part of this community for 130 years. I'm going to ask that Captain James Scott and also Hence Farland. James Scott is representing the Salvation Army. Pretty much the entire social service team except James is at a conference today on training, and so he's going to be representing the organization. Sergeant Hence Farland from Windsor Transitional Housing, a veterans-based agency that has been running our winter overflow shelter for the last 3 winters. Salvation Army and Windsor are teaming up to serve the men, so I'll just ask you to come up and then each of you say a few words. Thank you.
Thank you. We are excited to have the opportunity to continue our services to the homeless in collaboration with the City of St. Louis and with Windsor Transitional Housing. The Salvation Army is committed to a continuum of homeless services, including prevention, shelter, and housing. We offer these across the region. We are committed to providing services that will help homeless men move to more stable housing situations, including our housing options, such as the Relton Apartments, Veterans Residence, Booth Manor, Senior Apartments, the newly developed 3010 Apartments, and other permanent housing options in the City of St. Louis. We know that the services that we offer helps provide a pathway of hope for those that we serve. We know that the challenges and the barriers are great to achieving stable housing. Our goal is to be a bridge to those who to reach housing situations with dignity and pride. Thank you.
Thank you, Captain. Hence?
Well, good afternoon, or good evening, however you want to put it. It's a good thing that I'm standing here with all these organizations in communities. It's kind of strange that the environment that you grew up in, you stand right here as an ex-boxer, working in the communities through all the recreation centers of the city of St. Louis, with Mayor Slay and this idea of putting things together, reaching out to the homeless. So, as being the executive director of Windsor Transitional Housing, I'm a leader. And I think everybody here, I know everybody here is leader, so what we're going to do with this new project that we're putting in front of us. So, as a leader in service in the armed forces, the United States Army, 27 years in my experience of giving back to the community is greatly needed from everybody that's standing here on this floor here, or this building here, or this community. So, as I work with everybody as team members, and prefer my mission is to work as an obligation to this new program, this project that we're putting together here in the city of St. Louis in the areas that I work in. So as the mission is to reduce homelessness, and I think that's a good mission to put in front of us, to reduce the homelessness here in the city of St. Louis. And as Windsor Transitional Housing is pleased to partnership with Salvation Army and the city of St. Louis and all the other partners and the agency here in the city of St. Louis with my expertise. And I am dedicated, obligated to work faithfully in good faith of the homeless individuals that is homeless, to show respect as them being human beings and respect them and treat them respectfully and giving them an opportunity to get these services that we're all providing and putting in manner for the clients to work from, I think, Monday through Sunday. And that's my obligation is to put this organization together and to provide my veterans, and they are trained, and we are eager to start this new project, whatever it takes. Now, I say one thing. Now, since I've been working with this project with the mayor and working with the overflow, the numbers and the individuals that's coming off the street, we do have to have structure. We do have to have compliance. And the Windsor House is stepping out there, which I'm new to all of this, and I'm willing to come aboard and put my expertise in the community. All right.
Thank you. Tom Price is the Senior Director of Behavioral Health Services, and Margaret Egan is the manager of the Women's Night Program at St. Patrick's Center here in St. Louis, another great institution that has served homeless people. I think that Margaret is going to speak on the program in which they're participating as part of this enterprise.
Hello. St. Patrick's Center's Women's Night program will be adding 5 more beds to our program, which will bring our count to 20 beds total for women who are homeless and experiencing behavioral health issues and/or substance abuse issues. The women we serve have significant needs, and we are available to help them 24 hours a day. In 2014, we served 60 women total who came to St. Patrick's Center's Women's Night program. In addition to emergency shelter, we also provide intensive case management services, drug and alcohol outpatient treatment, art therapy, vocational and housing referrals, and trauma-centered therapy. And we look forward to serving and working with even more women in the community. Thank you.
Doorways is another great institution that helps people who are homeless, who have AIDS and HIV. Opal Jones, the executive director, is here to speak with you. They have made very enterprising use of this opportunity to create an emergency shelter bed, but also to work with the continuum of care and be a part of this in other ways that will promote the men and women who are in the men's shelter, the women's shelter, the night program at St. Patrick, and at Doorways itself. Opal?
First of all, I'd like to start by thanking the mayor for his enduring support of the homeless in our region and people living with HIV/AIDS. We are lucky to have his leadership and that of Eddie Roth, another tireless advocate. In our community, homeless people are 7 times more likely to be diagnosed with HIV than the general public. And a lack of stable housing leads to poor health outcomes for these citizens. That's why Doorways fully supports this new initiative. With the pending approval of our local HUD office, we will supply an emergency shelter bed at one of our existing facilities called Cooper House in the Central West End. This will be at no additional cost to the city. This bed will be reserved for people who are homeless and HIV positive, experiencing an advanced illness and in need of nursing care and help with their activities of daily living. In addition to that, we are committed to staffing these shelters with social workers who will routinely visit the facilities to identify people who may be eligible for assistance from Doorways. Further, we know that this is a new chapter in the homeless policy for the city, and Doorways is ready to collaborate in any meaningful way with the city and the other members of the continuum of care. Thank you.
Thank you, Opal. We just have one more speaker before we open it up to questions. When we talked about a new era of professionally managed, publicly accountable emergency shelter that's connected to services, it's a new era in part, but we have an example of a long-standing shelter that has met those criteria. And I'm going to introduce Tom Burnham from Peter and Paul just to say a few words. They have been a mainstay, and he's sort of the dean of emergency shelter done the right way here in St. Louis. Tom, would you say a few words?
I don't want to hear any snickering. I will try and be brief. Again, I'm Tom Burnham with Peter and Paul Community Services, which started in 1981 as an emergency shelter. It was a neighborhood response to a neighborhood problem. We were around for several years. In the mid-'80s, one of the innovations that began here in St. Louis and was recognized as a best practice by HUD and has since been duplicated in over 300 cities around the country is we had the first homeless services network, today known as a continuum of care. Those very words came from St. Louis. They came from the then director of Catholic Charities, and HUD has basically instructed all cities to have one of these, where we try to become aware of everyone's strengths and weaknesses, who the players are in the community, and how to best apply our resources. Over the years at Peter and Paul, we started with an emergency shelter. We've developed 3 transitional housing programs working with folks in recovery from substance abuse, folks living with major mental illnesses, folks living with HIV. These are clinical programs including licensed clinical social workers, occupational therapists, nursing and substance abuse counseling. We've also created a permanent supportive housing program for what are known as treatment-resistant chronic inebriants. This also has a clinical team on site. This has all been part of the development, and what we are seeing here now is another step forward in the development. I've always felt that we have never had a level of service to address the level of need. And, you know, adding another 175 beds, 150 beds, perhaps eventually another 225 beds is a major step forward. And coupling that with case management and supportive services is a major step forward. And we just need to keep moving in this direction. It's sometimes been 2 steps forward and 1 step back, but things are better today than they were 30 years ago. They're better today than they were 20 years ago. We just need to keep this trajectory moving forward, developing programs and services to address an ocean of need out there. Thank you.
I just want to kind of close it up before questions, and just to say to everyone here, thank you for all your work in addressing some of our most vulnerable citizens throughout St. Louis. And this is throughout the St. Louis area, because we in the city, in large part, provide homeless services for the St. Louis region. We serve the region's homeless, and we're very, very, very proud of that. We also know that this is hard work. There's nothing easy about what we do, and there's no exact way to address every situation. But what we are committed to is a continuum of care network, a network of individuals and organizations who care about those who are out on the street, who have the resources to provide the services for a new beginning, not a last resort, and also organizations and institutions that are good neighbors, that are professionally managed, that are publicly accountable, and I think as importantly as anything is connects these individuals that we serve to services that will help them in the long term. So again, thank you all for this. We have a lot of work to do. This is not simple, and we do have our challenges ahead of us. And certainly we would welcome the support as much as possible from the rest of the region whose homeless population we serve here in St. Louis.